What does good social work leadership look like?
I think that good social work leadership really could be described as being good system leadership because the skills are so similar. It's about being able to work with people. It's about understanding and getting place, in other words, being able to work effectively in place. It's about the ability to develop networks, to build those networks. And it's also, I think, about the ability to understand and manage in ambiguity because you're working in people's lives, supporting them, helping them to plan and develop the approach that's going to help them achieve the goals they've set for themselves. And I think the other thing I would say that is really critical to good social work leadership is that recognition that risk is not something that is managed by rote through tick boxes. Risk is something that's managed through relationships that are grounded in human understanding.
And how do we implement good leadership in everyday practice?
So how do we implement good leadership in everyday practice? I think first and foremost this has to be embedded in social work training from day one. It has to be seen as an integral part of what good social work is about. It does have to debunk the idea that leadership equates to management, that leadership is simply about hierarchical power. It most certainly isn't. Indeed, as a social worker sitting in someone's home talking about the things that matter to that individual, you're exercising power, you're exercising leadership. So having an ability to build that into good reflective practice, good supervision, all really reinforcing the notion that social workers at any point in their career are not necessarily going to be the most powerful person in the room, but they are always expected to lead and lead in the interests of the people they're there to serve.